A rare disease in the US is defined as a disease with an individual prevalence of less than 200,000 cases. And that definition is a legislative definition. It came from the FDA's Orphan Drug Act of 1983. Actually, the amendment to it in 1984. And what's been interesting is that over time, our sort of criteria for calling something a rare disease has become more conservative. So based on our 1983 population, the cutoff was around 70 cases per 100,000. And as the country has grown, that 200,000 cases today corresponds to a prevalence of about 60 cases per 100,000. And compared with other countries, we're actually a little bit more liberal. So countries like Japan and Australia are much more conservative. They call something a rare disease if its prevalence is like 9 to 10 per 100,000. The European Union uses a definition of 50 per 100,000. I think there's probably a range of reasons that are both sort of technological and health systems related. So from a technological standpoint, as we've gotten better at sequencing genes and recognizing when a mutation is pathogenic, categories of diseases that were previously sort of really big bucket categories, say something like developmental delay in children, which would give you like 5 million patients, can be subset into sort of smaller, more accurate groups of patients. So I think we are seeing more rare diseases because our definitions have changed. Then I think there's also some health systems factors that have gone into folks being more conscious of the presence of rare diseases. So things like the Uniform Newborn Screening Standards, which have helped us recognize more rare diseases very early on in life, efforts from the CDC and the NIH to collect data and disseminate it on rare diseases, I think have also played a factor.